Hello, I'm Dr. Eric Hensel with Active Edge Chiropractic and Functional Medicine. We're here today to do a little sort of mock exam on our intern Brock. So today we're going to be going over a little bit of what it's sort of like to come in and get an examination and possibly a little bit of treatment done when we're concerning sports injuries, and specifically some CrossFit, deadlift, squats, more of the big movements like that. We see a lot of weightlifters in here, and a lot of them suffer from, if not a lot of low back pain. Sometimes it's just mild, sometimes it's pain radiating down the leg, but we do a little bit of different things in here for those, a little bit different exams. So we're going to show you guys that today, walk you through a little bit step by step about what we do, so you guys can be more familiar with the process and see how we're sort of different and we take a little bit different approach. So we're going to have Brock lay down. Okay, so one of the big things that I like to assess on patients with low back pain is the front side and how our muscles there are firing. You'll notice that we aren't looking at the back right away for the lower back pain, but some of the muscles that attach to the back and move the back. So some of the ones that I like to look at are psoas and iliacus here. So we're going to have Brock resist here when I push down. Good, and he's nice and strong, and hold right here to let me push. And he's a little bit weaker there. Sometimes this will elicit lower back pain in patients, sometimes it doesn't. It's just weak and hard for them to do. And again, hold here on the side, good, strong there, and hold here. So both of Brock's psoas are testing a little bit weak and hard for him to hold. So we can do some different things called therapy localization to try and figure out what is going to strengthen those psoas muscles. We're going to start with the muscle itself. Hold right here, don't let me push. Good. And that made it nice and strong on his left side. And we're going to test the right side again. Hold here. Excellent. That is really nice and strong. I like to see that. So what that tells me is that the psoas is dysfunctioning, and we need to actually do some soft tissue work on the psoas, usually pretty tight and tender. And a lot of times a forgotten muscle, or one that most people don't even address or look at, but can affect a lot of low back range of motion, low back hip range of motion, low back flexibility, and strength, because it will also turn off the rectus and oblique muscles as well as the glutes when this is overactive and the fascial chain is being disrupted that way. So we're also going to test a few of the pelvic muscles, the glute med right here, hold out here, good, and the TFL, hold here, I'm going to pull down and in, excellent. Hold here, Brock, I'm going to pull in, and here, hold. Good. And so those test good with Brock. I like to see that. And so there'd be different things that we would do if those would test weak. Hold right here and arch your lower back, Brock. Don't let me push. Good. And a little tough for him to hold that. You should be able to hold those nice and strong. Hold right here, arch the lower back. Don't let me push. Good. And he fatigues out pretty easily. So what we did there is we looked for what we call an anterior disposition of the lumbar spine. I can feel that right through here. Very, very common with having that psoas dysfunction. So arch again, Brock, and hold here, don't let me push. Excellent, nice and strong there. And arch the lower back, and get on this side, hold. Good. So those both strengthened up nice, so we would actually adjust through there with Brock, get these loosened up. And more likely than not, there's going to be some sort of fascial chain dysfunction with those as well. A lot of times it comes into the adductors here. How do these feel, Brock?
Not too bad.
Not too bad. Good. And we're coming down here.
A little tighter.
A little tighter there. Excellent. Okay. Now let's flip over. Go face down. So now we can access hamstrings here. So hold right here, Brock, and I'm going to push here. Good. Hold out here, don't let me push. Good, and straight up, don't let me push. Good. Hold right here, don't let me push. Over here. And this way, hold. Those are looking pretty good. Now, what we're also going to look for is leg extension and how that looks, especially in response to the lower back. So Brock, I want you to keep this leg straight and extend it up off of the table for me. Good. And then same with the other side. Excellent. One more time here. Okay. And the other side. Okay, so with this, the right leg, you can see a lot more dipping in this lower back. On both sides, when he does this leg, it's bilateral dips down, and this leg, it's more the left side that's losing control there. So what that means is we're tight through those psoas muscles. He's having to do a lot of extension in his back, and that's more than likely going to translate into some stiffness, soreness in the lower back, and also maybe some arching at the bottom of a squat, maybe some tipping of the pelvis during that squat, or maybe not being able to get as low into those squats and deadlifts as you would like to. So getting those retrained, and then we can also look and assess the firing pattern of these muscles too, because that is very important in getting maximal effort out of your motion. So I want you to extend this leg now, Barack. Good, and down, and relax everything, and go again. Okay, down. So what we're looking for here is a very specific firing pattern. It should go glute, hamstring, and then low back muscles. And what's happening with Brock, and what happens with a lot of patients, is the low back comes on first, and then the hamstring, then the glute legs behind once that leg is up about 5-10 degrees or so. But what should happen, we should get this to fire first, and then the other ones in that order. So let's check this one here, Brock. Good, down, and relax. Go again. Good, so a little bit better here. This one's coming in a little bit quicker than that left side, and that's pretty indicative of when we see that low backdrop when we first assessed as well, to have to make these corrections in order to be able to get maximal effort out of your squats and lunges and deadlifts and everything else like that, and actually just holding your posture in general, walking, sitting at a desk all day, things like that. Very important for this firing pattern to go the way that it needs to. So all those things are something that need to be addressed. We have a lot of different ways that we can retrain these firing patterns, loosen these muscles up, get the joints going. He's got a little tightness in his pelvis and the low back here, and some subluxations that need to be addressed as well for optimal nerve flow and optimal function and movement. So hope you guys enjoyed the video. This is a little bit different approach. This is just sort of the tip of the iceberg. A little quick 3-4 minutes of what we would do a little bit differently, how we'd assess some of these different options for our patients. Hope you have a great day and look forward to talking to you soon.